Next, though, this item I wanted to share with you regarding the Northwest's first and only virtual heart failure ward is being launched from today. It's a joint venture between Merseyside and the Liverpool University Hospital's NHS Trust. The virtual ward will allow heart failure patients to receive care at home via the use of technology. It's only the second ward of its kind in the whole country, and Dr. Rosie Kaur is the Merseycare's Deputy Medical Director, and earlier she explained to me how it works.
A virtual ward is a way of delivering care that you would expect to get in a hospital, as if you're in a real ward in a hospital bed, but we deliver the care to you in your home. And the virtual element of it is that we deliver the monitoring via technology, remote monitoring technology. But the ward is still staffed by experienced nurses and overseen by a heart failure consultant. So you get care that you would have in a ward, but it's in your home, and that's what we would call a virtual ward.
And how much of an impact could this have on the number of beds being freed up in hospitals?
We're aiming to try and, in the next 6 months, try this out with 200 patients. Now, the thing to say is Merseycare has been running a telehealth hub since 2009. So we're very experienced in delivering care to people in their own homes using technology. And this was a natural progression. And the model that works with Merseycare is that the patient has a technology device in their home that allows them to input questions about how they're feeling, or blood pressure or pulse. And those readings are picked up by a hub of experienced nurses who used to looking at the readings, who can then contact the patient in their own home and speak to them. And then they will then also work with a consultant who will also be overseeing that workload. And, over 6 months, we want to get around 200 patients, which is about 5 to 10 people a week, out of hospital earlier, because we know that people do better in their own homes, they recover better. But there's also, the opportunity to pick people up early when they're in their own homes, to pick them up if they're becoming unwell and hopefully prevent them going into hospital. There's definitely potential for releasing a substantial amount of beds. But I think the main thing I want to say, this is not about releasing beds. This is about making sure people want to be cared for in their own homes as long as it's safe. And so that's the main premise behind this, is about looking after people in their own homes.
There's only one other ward of its kind in the country. How successful has that one been? And do we hope to see more wards like this in the future?
There's one other heart failure virtual ward in the country. They have been successful. There's definitely been some learning that we will take from their experience. And I think the main learning that we've taken from their experience is it's really important to have a clinical leadership. So we have a consultant oversight for this ward, who is a heart failure consultant. So, and that's our main learning. I think there are going to be other virtual wards for this. Currently, where we've also run a respiratory virtual ward, which is overseen by a consultant respiratory physician, and there may be other clinical areas that we develop. I think as the technology improves, and that we know that we can, and the technology is usable by patients, and that they know that they're safe and they're able to be at home. The feedback we've had from our patients is the combination of technology that is safe and dependable, a hub of experienced nurses who they can contact at any time should they have any problems, is that this is the way patients would want to be managed as much as possible. And that is all about making sure that patients, are safe and happy in that virtual ward environment.
And people listening may be surprised to hear that heart failure patients can be looked at home. What safeguards are there in place to ensure that those that do need urgent treatment can still get it?
So every day, the patients will be entering their readings via their devices, and those readings will be a combination of blood pressure, pulse, temperature, step count. They'll also be entering daily information about how they're feeling. So are they more breathless? Are they, are their ankles swelling? Are they getting any chest pain? And the pathway that we've designed has been set up by our cardiac consultants. So the thresholds for escalation have been set by the consultants who are experienced in looking after heart failure patients. And those thresholds with technology are picked up by the nurses. So when those alerts go, it's a nurse, an experienced nurse, who will call the patient. And that nurse then also on a daily basis speaks to the heart failure consultant, who has oversight for the ward. So the heart failure consultant as he would in the hospital, remains responsible for the patients on that caseload. So it's not that the technology is looking after the patient, the consultant is looking after the patient. And that's a difference there, but it's being enabled through technology. And the benefits of that are we can actually pick up people earlier if they start to deteriorate, rather than if people get to the point where they're really feeling quite unwell and at that point they seek medical advice, we can actually pick them up sooner.
That's a really good point to make, because being at home and in your own environment is incredibly important, isn't it, for patients' recovery?
Yeah, well, we know, I think it's in the first week in hospital, people have a thing called deconditioning, which is essentially, the muscle mass reduces by about 10 to 20%. And for our frail patients, that's a big thing, isn't it? You want to keep them independent and able to do the things they've been doing at home as much as possible, but it's got to be safe. And that's why we make sure that the technology is right through our partners in Docabo and their platform, and the clinical oversight is right from our partners in Luft and our consultant cardiologist who is overseeing the ward and the development of these clinical pathways.
That is Dr. Rosie Core, Merseycare's Deputy Medical Director.